Hi guys. The reason I'm doing two videos, one's a mystery diagnosis, the other I just found randomly about Angelman syndrome. I was going to do mystery diagnosis for Angelman syndrome, but I didn't like the audio quality. So if there's a video's quality I don't like or I can't find the video, I will just look somewhere else for the video. Just because the audio is messed up in one video doesn't mean I can't find the same condition with a different quality. So I hope you enjoyed this. Anyway, on to the video.
Figuring tumor that has been growing in her neck for more than 15 years. But now, it's causing her so much pain that she can't ignore it any longer.
She was terrified of anybody touching her neck or even that side of her face.
When someone would go to hug me, I would find myself turning my head to keep anyone from hitting it. This tumor is now taking over my life.
After nearly a decade and a half without so much as a checkup, she finally makes an appointment with a facial, plastic, and reconstructive surgeon, Dr. Eugene Alford.
I was sitting there waiting for him to come in, and I was panic-stricken. I just couldn't believe I was in a doctor's office. I couldn't believe that somebody was going to look at this. And he was so sweet, and he at first looked at me and was surprised about where's the tumor.
She pulled her hair back and revealed this very large mass in her neck that went from just below her ear and the side of her jaw all the way down to her collarbones. It was enormous, to say the least. Much bigger than a softball when I saw her the first time. It's very uncommon to see someone with a tumor this large. You're immediately struck by how could someone live with this?
Dr. Alford begins giving his anxious patient an extremely thorough exam. And almost immediately, he quells Daisy's greatest fear. The growth is not cancerous.
I knew that number one, the tumor was benign because it had been there for more than 10 years and she was still alive.
But now he has to figure out just what's causing this growth in the first place. Dr. Alford orders an MRI so he can get a clearer sense of exactly how big it is and pinpoint its location inside her neck.
I told her I didn't know if we could take it out or not. It may be something she would choose to live with.
2 hours later, the MRI results are in, and the news is not good.
This is a tumor which is occurring in the deep space of the neck, called the parapharyngeal space.
This is a challenging space for doctors to examine, as all of the major blood vessels and nerves in the neck run through it. To make matters worse, it's clear to Dr. Alford that Daisy's tumor has grown around her carotid artery.
That's the main artery that supplies blood to the brain. We knew that the tumor's center had derived from the junction of the internal and external carotid arteries, that this was a highly vascular paraganglioma.
Paragangliomas are rare tumors that only grow near the adrenal glands in the abdomen and certain blood vessels or nerves in the head and neck. They're derived from very specialized nerve cells called paraganglia that monitor and help control blood pressure and breathing. It's unknown why these cells suddenly mutate and grow abnormally, but in Daisy's case, the mystery is even more profound.
Paragangliomas in and of themselves are very rare. Most of the ones we see are the size of a pecan, a walnut, maybe a big one the size of a baseball. Never seen one bigger than a softball. And that
her life is literally on the line. If she lets the softball-sized tumor be, it could rupture and she could bleed to death. If she has it removed, Daisy may not survive the extremely dangerous surgery.
I
Daisy up 4 hours sooner than he expected and heads out to give David and Melanie the good news.
the best part was there'd been no stroke, no vascular compromise, no brain damage, and we really anticipated she would be just fine.
The moment I woke up, the pain was gone. It was just unbelievable. I asked Dr. Alford, where's the pain? I have no pain.
And I said, because the tumor is gone, and that's the way it should be. That's the way it's supposed to be.
And we knew she was on her way to feeling much, much better.
While the surgery was a success, it did cause permanent damage to the nerves that control Daisy's ability to swallow. Today, just 17 months later, she can swallow some soft foods, but she relies on shakes packed with nutrients to help maintain a healthy diet.
I can get my vitamins and minerals that way. And that's what I drink every day of my life.
Daisy learned so much.
The next case is Angelman syndrome. And this syndrome is no angel. And it doesn't really seem that bad. And parents who have kids with Angelman syndrome, it seems like it'd be rough, but not that rough.
Angelman syndrome is a genetic disorder. It causes developmental disabilities, neurological problems, and sometimes seizures. People with Angelman syndrome often smile and laugh frequently and have happy, excitable personalities. Developmental delays between about 6 and 12 months of age are usually the first signs of Angelman syndrome. Seizures often begin between the ages of 2 and 3 years old. Causes. Angelman syndrome is a genetic disorder. It's usually caused by problems with a gene located on chromosome 15, called the ubiquitin protein ligase E3A or UBE3A gene, a missing or defective gene. You receive your pairs of genes from your...
I'm going to explain this. As I said, I memorized the rare medical conditions, so I can tell you all about Angelman syndrome. But if you give me something like Down syndrome, I have no freaking idea. Like, it may be on the 57th chromosome, so I have no idea about stuff like Down syndrome. But give me the rare stuff, that's easy.
From your parents. One copy from your mother, the maternal copy, and the other from your father, the paternal copy. Your cells typically use information from both copies, but in a small number of genes, only one copy is active. Normally, only the maternal copy of the UBE3A gene is active in the brain. Most cases of Angelman syndrome occur when part of the maternal copy is missing or damaged.
Right.
In a few cases, Angelman syndrome is caused when 2 paternal copies of the gene are inherited instead of one from each parent. Signs and symptoms.
So if you don't get that, that basically means that Angelman syndrome occurs when they get the genes from the dad and not from dad and mom, but get both sets of genetics from the dad.
With Angelman syndrome appear normal at birth, but often have feeding problems in the first months of life, and exhibit noticeable developmental delays by 6 to 12 months. Seizures often begin between 2 and 3 years of age. Speech impairment is pronounced, with little to no use of words. Individuals with this syndrome often display the following that can have severe functional deficits: hyperactivity, small head size, sleep disorders, movement and balance disorders. Children with Angelman syndrome typically have a happy, excitable demeanor with frequent smiling, laughter, and hand-flapping movements. In addition to hyperactivity, a short attention span and a fascination with water are common. With age, people with Angelman syndrome become less excitable, and the sleeping problems tend to improve. However, affected individuals continue to have intellectual disability, severe speech impairment, and seizures throughout their lives. Adults with Angelman syndrome have distinctive facial features that may be described as coarse. Other common features include unusually fair skin with light-colored hair and an abnormal side-to-side curvature of the spine, also known as scoliosis. The life expectancy of people with this condition appears to be nearly normal. Diagnosis. A definitive diagnosis can